Good morning, everyone, and thank you for joining me today. We're going to explore comprehensive approaches to childhood mental health, focusing on assessment, diagnosis, and treatment. Throughout this presentation, we'll delve into how integrating developmental, cultural, and evidence-based practices can enhance and personalize care, ensuring that children receive the most effective support possible. I'm excited to share these insights with you and discuss how we can better serve the mental health needs of young people. When we talk about assessing, diagnosing, and treating childhood disorders, it's important to recognize that these issues are often complex and layered. Children like Felicia don't just face one challenge. They are navigating their growing independence, relationships with peers, school pressures, and their emotions, all of which can be made even harder by stressful events they experience. That's why a thorough and systematic assessment is crucial. We need to look at how the child is coping with these life events, while also considering their physical health, cognitive abilities, behavior, and social support systems. This approach helps us understand the full picture of what the child is dealing with. As C.G. Jung once pointed out, before we try to change something in a child, we should reflect on whether the change might need to happen within ourselves first. This perspective reminds us to approach assessment and treatment with empathy and self-awareness. When assessing children with psychological difficulties, the process is quite complex. It's much like being a detective. We gather clues, form hypotheses about what might be going on, figure out the underlying causes, and consider the best ways to help. This kind of decision-making requires careful thought and flexibility. One important distinction to keep in mind is between idiographic and nomothetic approaches. The idiographic formulation aims to understand the unique details about the child and their family, what makes their situation special and different. On the other hand, nomothetic formulation looks at broader principles that apply across different groups. Both perspectives are valuable in shaping an effective understanding and plan. Finally, clinical assessment isn't a one-time event. It's a continuous collaborative process that involves working closely with the child, their parents, teachers, and other clinicians. By maintaining ongoing communication and interaction, we can adjust our approach and interventions as needed, ultimately supporting the child's well-being and finding the most effective solutions. When we consider childhood disorders, age plays a significant role in the types of issues children may experience. For example, boys more often show early-onset disorders such as ADHD and autism spectrum disorder, while girls are more likely to develop problems like depression and eating disorders during adolescence. These gender differences are important because they help us understand when and how certain disorders tend to present. Cultural background is another crucial factor. It shapes not only how symptoms appear but also how they are diagnosed and how families engage with treatment. This means that healthcare providers must be culturally competent to accurately assess and support children from diverse backgrounds. There is also an increased risk of misdiagnosis among ethnic minority children. This risk underscores the importance of being aware of cultural syndromes and recognizing the rich diversity within cultural groups so that children receive the right diagnosis and care. Finally, socioeconomic status and the process of acculturation can influence both the diagnosis and treatment of childhood disorders. These factors affect access to resources and support, which are essential for effective intervention. Understanding these developmental and cultural considerations helps ensure more accurate identification and better tailored treatment for all children. When assessing disorders, it's important to use multiple methods to get a comprehensive understanding. Clinical interviews are a key part of this process. They allow us to gather flexible and detailed information from the child, parents, and teachers, which helps paint a full picture of the situation. Next, behavioral assessment often uses the ABC model, which stands for antecedents, behaviors, and consequences. This approach helps us observe and analyze behaviors within their specific contexts, making it easier to identify patterns and triggers. We also rely on checklists and rating scales, such as the Child Behavior Checklist or CBCL. These tools offer standardized ways to compare a child's behavior against typical behaviors for their age and gender, which can highlight areas of concern that need further attention. Finally, psychological testing covers a range of assessments, from developmental screenings and intelligence tests like the WISC-V to projective tests that explore inner thoughts, as well as personality inventories and neuropsychological assessments. These various tests help us understand different aspects of the child's functioning, including how brain processes relate to behavior. Together, these multi-method approaches give us a well-rounded view and guide effective interventions. Felicia is a 13-year-old girl who came to us showing several concerning symptoms, including depression, avoiding school, pulling away from friends, trouble sleeping, and dropping grades. These issues started after some very difficult family events, like her mother's hospitalization and her grandfather's passing. When we looked into her developmental and family background, we found that she had some delays in reaching milestones and tended to be very dependent on others, especially within the family. We also learned that her mother had a history of depression, and the recent family stress added more pressure. Our behavioral assessment revealed that Felicia's avoidance of school was actually being unintentionally encouraged by the attention she received from her parents during those times. Cognitive testing showed that she has average intelligence, meaning her academic struggles are likely related to her emotional state rather than intellectual ability. Taking all this into account, we diagnosed her with major depressive disorder, single episode, with mild anxious distress. This diagnosis reflects the mild to moderate severity of her symptoms and the significant impact they have on her social life and school performance. When we talk about classification systems in childhood disorders, it's important to understand that these disorders are classified in two main ways, categorically and dimensionally. Categorical classification means identifying distinct diagnoses, while dimensional classification looks at traits along a continuum, recognizing that symptoms can vary in severity. In North America, the DSM-5 is the primary categorical system used. It provides specific diagnostic criteria and includes specifiers that help us describe subtypes, severity levels, and any co-occurring conditions, which makes diagnosis more comprehensive. The DSM-5 covers a broad scope of developmental disorders. It includes neurodevelopmental disorders, as well as other clinical disorders that can affect individuals from childhood through adulthood. The manual emphasizes the importance of developmental context, adjusting criteria to fit different ages. However, the DSM-5 has its share of criticism. Some argue it doesn't adequately cover disorders that appear in infancy and that there can be significant overlap between symptoms of different conditions. There's also concern about the stigma that can come from diagnostic labels. Lastly, some feel it doesn't sufficiently consider situational or environmental factors that influence behavior. Despite these challenges, the DSM-5 remains a crucial tool in clinical practice. When we talk about treatment and prevention strategies, it's important to first understand the focus of prevention itself. Prevention aims to reduce risks and promote overall well-being before any problems actually develop, essentially stopping issues before they start. On the other hand, treatment is about addressing existing concerns. It works to reduce symptoms and help individuals function better in their daily lives. Maintenance then becomes crucial once improvements are made. Its goal is to sustain those gains and prevent any relapse back into old patterns or difficulties. Effective care often involves combining and tailoring different interventions. For example, integrating cognitive behavioral therapy with social skills training can address various aspects of a person's challenges simultaneously. In Felicia's case, her treatment plan included behavioral programs to improve her school attendance, cognitive behavioral therapy to manage her depression, and social skills training. This multifaceted approach showcases how assessment guides us to create targeted, personalized treatment plans that address the unique needs of each individual. When we talk about cultural competency in treatment, one key idea is the cultural compatibility hypothesis. This suggests that treatment is more effective when it aligns with the child and family's cultural values and practices. In other words, understanding and respecting their cultural background can really enhance the outcomes. Parenting styles and beliefs about childhood challenges also vary greatly across cultures and influence how families engage with interventions. For example, African American families might lean towards stricter discipline methods, while Latino and Native American families often adopt a more permissive approach. Recognizing these differences helps tailor intervention strategies that feel appropriate and respectful to each family. Finally, adapting interventions to include cultural narratives, role plays, and core cultural values like formalism, which emphasizes family loyalty, and respeto, or respect, can make treatments much more relevant. This cultural tailoring can significantly improve engagement and results among diverse ethnic groups. When working in child mental health, it's crucial to recognize the unique vulnerability children have, which means we must be especially careful in how we assess and treat them. One major challenge is finding the right balance between maintaining confidentiality and respecting parental rights, while also making sure the child's participation is voluntary and suited to their developmental level. Ethical standards guide us to always aim for the best treatment goals for the child, secure active consent, keep detailed records, protect confidentiality, and ensure we maintain our professional competence. Clinicians often face complex decisions, such as when to honor a minor's autonomy, how to obtain informed consent appropriately, and how to manage clear role boundaries. Lastly, it's important to understand the legal frameworks that govern care and education rights, particularly for children with disabilities, so we provide care that is both ethical and legally sound. When it comes to treating childhood disorders, there's no one-size-fits-all approach. Treatments are quite diverse and often combined to best meet the child's needs. Psychodynamic therapies, for example, focus on uncovering unconscious conflicts, often through play or talking, helping children express and work through underlying issues. Behavioral treatments, on the other hand, use learning principles like reinforcement and timeouts to modify problematic behaviors directly. Cognitive therapies aim to challenge and change faulty thoughts and beliefs that lead to maladaptive behaviors. Many modern approaches blend these techniques, such as cognitive behavioral therapy, which targets both the child's thought patterns and behaviors in an integrated way. Client-centered therapy adds another important layer, emphasizing empathy, acceptance, and helping the child grow in a self-directed, supportive environment. Beyond individual therapy, we also consider the family and biological factors. Family therapies address the relational dynamics that may contribute to the child's difficulties, working systemically to improve interactions at home. Neurobiological treatments, including medication, target brain dysfunctions that might underlie symptoms. For instance, Felicia's treatment combined cognitive behavioral strategies, behavioral interventions, and social skills training, illustrating how multifaceted these treatment plans can be to effectively support children. Best practice guidelines are grounded in a combination of solid scientific evidence and expert consensus, ensuring that the recommended treatments are both effective and cost-efficient. When we look at evidence-based treatments, or EBTs, research shows that about 63% of youths who receive these treatments improve significantly more than those who don't get any treatment. Psychotherapy, in particular, has proven to be effective across a wide range of disorders, ages, and ethnic backgrounds, with the positive effects often continuing even after the therapy has ended. However, the level of effectiveness can vary depending on the disorder, with the strongest results typically seen in treating anxiety and somewhat lower effectiveness for depression. One important challenge is that therapies conducted in real-world clinical settings often yield smaller improvements compared to those seen in controlled research environments. This highlights a critical need to focus more on enhancing patients' overall life functioning and finding better ways to connect research findings with everyday clinical practice. When we look at child mental health today, one of the biggest challenges is the treatment gap. Despite considerable advances in the field, about 70 to 80% of children who need mental health care do not receive it. This issue is even more pronounced among ethnic minorities and children involved in welfare or justice systems. To address this, new initiatives are focusing on raising awareness and recognizing the unique mental health needs of children. At the same time, we're seeing expansion in how services are delivered. Technology plays a big role here, alongside the involvement of non-traditional providers, self-help approaches, and integrating care into schools and primary healthcare settings. This broadening of service models aims to make support more accessible where children already spend their time. Another critical piece is improving coordination across different systems: education, healthcare, social services, which helps increase access and ensure care is culturally competent. It also supports spreading evidence-based practices more widely. Ultimately, all these efforts share the goal of bridging the treatment gaps, reducing both societal and personal costs associated with childhood mental health disorders. This is essential for fostering healthier futures for our children. To effectively assess and diagnose, it's crucial to consider developmental stages, cultural backgrounds, and the broader context of each individual. This means blending personalized, idiographic approaches with broader, non-methodic methods to get a full picture. Using multiple assessment methods like interviews, behavior observations, checklists, and formal testing helps us achieve more precise diagnoses and create targeted treatment plans. While classification systems such as the DSM-5 are valuable tools for communicating about disorders, we must be mindful of their limitations, including the potential for stigma and the inherent complexity they bring. When it comes to treatment, the best outcomes come from approaches tailored to each person's unique needs and cultural context, often combining various strategies guided by established best practices. Looking ahead, improving access to services, enhancing cultural competence, and better linking research with real-world community practices will be key to achieving better outcomes for children and families.